can hear something calling. It's calling me every day. If taking a chance is a crime, then I've got hell to pay. I've been walking the streets in my mind, trying to find a new day. Keep on searching until I will find, until I find a new way. I'm gonna say something, I hope you don't mind. It's time to rearrange. I walk round in circles, I'm going nowhere. It's time to make a change.
Hi, everyone. Thanks for tuning in. I'm your host, Charles Wallace. Well, as you know, for 2024, I've decided to try to somewhat step out of my comfort zone as far as the type of guests and people I interview. I'm extremely excited to bring this interview today, as it is definitely outside of my comfort zone. And I hope that I didn't embarrass myself or embarrass this guest, because his intelligence level is through the roof. An extremely talented and motivated, world-renowned spine surgeon. Let's jump on into my interview with Dr. Stefano Sinicropi. Hey, good morning, Dr. Stefano. How are you today?
Doing great.
Listen, I really appreciate you joining me on the show. I made a comment or a post a little bit back for 2024. I'm trying to stretch my own self out of my comfort zone. I think speaking to someone of your caliber, surgeon, is definitely going to stretch my limits, make me better. Hopefully I don't embarrass myself. More importantly, I hope I don't embarrass you, but I'm really grateful that you decided to join me today. Would you mind doing a brief introduction of yourself for the audience?
Sure. First of all, just want to say I'm honored to be on your show. Thanks for asking me to be on. I follow your content. It's great. Watched a bunch of your podcasts. People really should follow along. Just getting back to myself. My name is Dr. Stefano Sinicropi. I'm usually pretty informal, but I'm an orthopedic spine surgeon. I'm out here in St. Paul, Minnesota. I've been a spine surgeon for 18 years at a place called Midwest Spine and Brain, and we do both neurosurgery and spine surgery in our clinic. My background is orthopedics, but I have 5 neurosurgical partners, so we do everything, spine and brain, and cover level 1 trauma center, and are expanding pretty rapidly, and they're excited about taking care of people in this community.
I'm so excited to talk to you. I listen, not to the level you're at, obviously, but I've been in healthcare data analytics for going on 30 years now. So I enjoy having a conversation in this type of area. So I'm definitely excited. So spinal surgery, what inspired you to specialize in that?
I mean, that's a great question. And so, initially when I was in medical school at some point, I started thinking about wanting to become an orthopedic surgeon, just having been around athletics and things like that, having dealt with really bad fracture of my humerus on the left side when I was a kid. I was always enamored with these orthopedic surgeons and kind of felt like they walked on water. So at some point, I just, I was deciding, do I want to do maybe neurosurgery? Do I want to do orthopedic surgery? But I was just called to I just felt like the orthopedic surgery crowd, let's just call them, was just something where, that was a fraternity that, and let's just say fraternity and sorority. I don't want to leave anybody out, but that was something that I was really excited about. So I went down the road of orthopedic surgery. And interestingly, when I first started in orthopedic surgery, I kind of loved everything. And initially, I started gravitating towards doing shoulder, elbow, hand kind of surgery. The chairman at the time at Columbia University, where I did my residency, his name was Louis Biliani, famous shoulder surgeon who's invented all these total shoulder replacements, actually named after him. And so I got a lot of kind of that shoulder thing. And then William Levine, who is now the chairman of the program, was a big mentor of mine, as well as this other doctor who I absolutely have to mention because I did his research program for years. His name is Melvin Rosenwasser. Just amazing people, and they were all in either hand and upper extremity work. So I was really, really interested. But I got to tell you, the first time, I really had an opportunity to be in rotations where I was doing, primarily spine surgery. I fell in love with it immediately. Just the complexity level of it, the intricacies, the fact that you're really dealing with some really seriously compromised patients, and just loved the anatomy, loved everything about it. And it just didn't take long before I declared, I wanted to be a spine surgeon, and then just put all my eggs in that basket at that time.
Wow, that's amazing, amazing story. When I think about spinal surgery and the spine, doctor, I thought something I wanted to ask you that kind of transitions is because I see your content online too. When I think about the spine, I think how there's not a lot of room for error. There has to be a lot of precision there. How do you take that precision and kind of relate it into the rest of your life?
I mean, that's a great question. First of all, like everything, we do, even when I'm, talking to my patients about what we would consider quote unquote a simple surgery, like just taking out a disc herniation, which could take, 25 to 40 minutes, really small surgeries, patients go home the same day. We always say simple, but certainly not easy.
Mm.
And so I think that I've taken that, that kind of mantra into my own life. There's a lot of things that just kind of seem simple, like being a good dad to my children, or a good husband to my wife, or, really a dedicated in anything I do. A lot of the things seem simple. They're simple if you put your whole self into it. Right. And then they can be easy, because they certainly are not easy. And so everything that I do, I really take that kind of to heart. And on the precision front, certainly what I do in my work life, there's not a lot of room for error, as you know. In my outside life, most of the things that we're doing, there is a lot more room to experiment and stuff. And I just take that to heart. And what that allows me to do is to take a lot more risk outside of what I'm doing. Because I certainly, what we do, you as the surgeon, you don't want to be taking risks. There's enough risk with just having some of these huge procedures that we do in and of itself. So hopefully that got to the heart of your question.
No, definitely. I really enjoyed that answer too, as you were saying, and I was just trying because obviously now I'm connected with you through social media and LinkedIn, and I enjoy your content. And when I read your content, I'm envisioning the surgeon and what you're putting out there, and it's kind of two worlds kind of colliding together, but it becomes this great mix. And I'm so happy to be connected with you, but really happy what you're doing, because I think it's going to be valuable for a lot of people outside of your own space, which I think is really good. So as far as surgery, and I see some of the things looking, doing some reading about you, I also see that you definitely seem like a person who doesn't want to stay pat. You really seem like you continue to evolve, not just in your personal life, but in your professional life. How has your approach to surgery, and even some of the things I see you talk about with holistic treatments and
Mhm.
that area, how has that evolved over time?
So I'd say, I'll break that down into a couple different, pieces. I think one of the things I learned as a surgeon is that we have to push our own boundaries as surgeons to see what we can really be capable of. And so some of the different techniques that I've kind of learned over the years, and some of the ways I've really learned to be efficient, has really, kind of helped me to push my own self to be better. And so every time, once, the first 5 years in practice, I will say, people say that you're not really a spine surgeon until you've practiced for 5 years. So let's just take the first 5 years and say those first 5 years were the years where I just developed my skills, built your confidence, built your patient rapport, built your practice. After that, one of the things I would always ask myself whenever I did a surgery, always, how can I do this surgery better? How can I do it more quickly? How can I do it with less blood loss? How can I do it with making it a safer operation for the patient? So I've always constantly pushed and pushed, the boundaries of myself. And that's how I've been able to get to the point where, we're able to manage so many, lives in one day and do so many cases. First of all, I have a great team. Without the team, we're nothing as surgeons. I think you see that from my content. People do not have a clue how many people are involved in making us successful. Without them, we just can't do what we do. But that being said, taking that, to heart, and just kind of the way, I've been able to push myself there. One of the things that is really near and dear, to me, is how sick these patients are that we've been taking care of for all these years. So I noticed this a long time ago. I was always thinking to myself, why are half the people coming in? They're coming in for their spine, condition, but really, I might be able to help them with their life's journey by thinking about how can I make you healthier and how can I make you better. And so the first way that I went down that path is I really became pretty obsessed with diets. Okay, because I had, gone through, my own, trial of diets. I had done keto diet. I had done a paleo diet for a long period of time with fairly good success, and then eventually switched over to an intermittent fasting diet, which I think is really one of the easiest diets for patients to follow. But anyway, I was first initially drawn into this by dieting. And so at one point or another, I just had an epiphany. I said, you know what? When patients come in and they clearly are struggling with nutrition or metabolic health, I'm really going to get involved in their diet plan. And interestingly, I didn't know how patients were going to respond, right? Because they're coming in, they have pain down their leg, and here's the doctor talking to them about, paleo diets and how to shop for that and how to manage their days, or intermittent fasting. And I was really happy to see how patients were welcoming this information with open arms. And in fact, a lot of patients commented, geez, I've seen a lot of people before and no one's really talked to me about it. Or you hear a lot in our community that people are somewhat afraid that they're going to be seen as confrontational if they ask people about their weight or their current conditions, or why they're on, so many medications at such a young age, or what is this what does this medicine do? Do you even know what this is for? Do you realize why you're even put on this? And so that was my first kind of foray into the whole wellness space. I tried to do, it's a little bit more difficult with my patient base to talk about getting into, let's say, hardcore exercising, just because a lot of them are just struggling with their other conditions. So it made more sense to focus on the nutrition. And then once I got into the more holistic, modalities, first for myself, and then, doing these other ventures with the wellness centers and things like that, I was able to then really transition and start looking at the patient as a complete whole. And so when patients come in now, I just kind of tell them, listen, I'll talk to you as much as you want about your spinal condition, but I know what I'm going to do if you choose to go that direction, right? I mean, but why don't we talk about these other things that are going on? Like if somebody comes in and says, hey, like I'm constipated all the time, it's incredible as doctors what we hear. We hear everything. Like if you just tell me something and I've heard it. I mean, that's just the way it is, because people are just happy that somebody's listening to them, right? And so now I'm able to really try to put it all together. So we talk about diet, we talk about nutrition, we talk about vitamin deficiencies, and then we talk about some modality hacks. And then I tell them if we can get them through that part of it, which I don't want to say it's definitely not easy,
Hmm.
somewhat simple, but not easy. if we can get them at least feeling better, then we can start directing them into really great trainers and and these other things. And I say, you know what, if you start getting healthier and feeling better, your physical therapist is going to be, it's going to be a lot easier for them to work with you, because you're going there, you're not drained and not rolling your eyes when they tell you, even just to get started, and so on and so forth. So just looking at the patient of the whole is really exciting me. I'm so happy with how open patients have been to listening to kind of what I have to say about it, even though, I'm a spine surgeon. They just value our input. And then now I really want to, the next iteration is I really want to push my boundaries, talk to as many experts as I can, read as much as I can, become an expert myself in all these, to a degree. I'm never going to be an expert. Like if I bring on somebody on the microbiome, I'm never going to have their level of knowledge. It's just, that time has come and gone. I mean, I've kind of chosen my path. However, I can become kind of a mini expert on all these things, and I want to put it all together and start making really individualized recommendations for each person as to how it can improve their life. And man, we can make such an impact on people if we just direct them in the right place.
Man, you from someone in my career in healthcare data, I've unfortunately gotten to see a lot of the bad as far as people's conditions. And hearing you speak about it the way you are, I always used to wonder, going back a few years back, doctor, why more doctors weren't having your approach. And hearing you speak about it, it excites me and gives me hope and makes me happy that I'll just say, I think any of your patients are lucky to have you. It's fantastic. And
I appreciate that.
You really do a great job in humanizing the modern day physician. And you make me excited about healthcare and that you're looking to help patients. So that's it. Just it really exudes from you. I wanted to go down a path with you because I seen when I was researching some things for today. Um, I know that you have some other clinics, and I know there's some focus you have on mitochondrial health.
Mm-hmm.
And I'm bringing that up because my family actually has a history of mitochondrial disorders. I lost a cousin years ago, 16 years old. I have another cousin who's dealing with some stuff. Um, I wanted to bring it up because I do think that people hear the word and they become intimidated by it. But I was hoping maybe you could break it down more into in layman's terms, talk about the importance of it and how people don't shy away from the word, but understand what it is and how it can help you in areas of your recovery, performance, anti-aging, things like that.
I mean, I think that's a great question, and I think really doing it in lay terms is really what I spend most of my time doing, and just trying to translate some of these things. And I always, when I talk about mitochondria, because I do almost all of my visits now, because I just want to tell people how some of the things I'm going to recommend can help them. I'll just go through that spiel because that I think is a good way. So what mitochondria is in layman's terms, it's basically the engine of the cell. So for the people that have gone through biology or remember their biology class, they are basically centers that produce something called ATP, which is adenosine triphosphate. And that is the gasoline that fuels all of the functions of your cell. And so many diseases now, okay, including a lot of degenerative diseases, autoimmune diseases, this and that, they're being really found to be mitochondrial dysfunction disorders. And so a lot is not known about mitochondria, and a lot of the markers on mitochondria are really, being worked at now. But what we know is if you feed your mitochondria by, taking care of your nutrition, things like that, they're going to produce that gasoline that your cell is going to use better. So better functioning mitochondria produce more ATP, and then your cells can actually work. So all the functions of the cells, and obviously a heart cell is going to be different than a liver cell, and so on and so forth. But let's just take any cell. One of the main functions of the cells is, they accumulate a lot of junk in them. right? They just accumulate garbage over time. And so one of the things the cell has to do is it has to get rid of that garbage. So it has to chew it up and it has to spit it out. And if your cells are not working at their best, you can't do that. And what do you get? You get a bunch of sick cells. And you multiply that by, trillions of cells, which what we have in our body, and you're sick. And so the question is, how do we nourish that? And some of the ways are just through clean diets, NAD, other things that are being done out there, in the market. But one of the things that we're looking at, in addition to some of the nutritional factors, is essentially shining a light on mitochondria. So the mitochondrial wall, not to get into the all the science of it, but there's all these pumps in there and they pump things in and out, and that's kind of how they work. It's an engine, right? And so if you shine, like, for example, red light, and you get it on the mitochondrial wall, what it does is it stimulates that wall, it absorbs there, and it just forces the mitochondria to start pumping out ATP. And so those cells are just rearing to go. And that's why, like, the red light therapies and some other light therapy modalities, some of the laser treatments that we've become big proponents on, what they're doing is stimulating your mitochondria again to produce energy. And that energy then can allow those cells to heal themselves and just function better. So, like, imagine revving up the mitochondrial function in your brain cells. What do you think happens there? You think you're better or worse? And so it's fantastic. And so that's why there's a lot of work now being done on transcranial light therapy to treat neurodegenerative disorders and to treat concussion and things like that, with really good results. And a lot of that's being done out of Harvard and some other, like, great institutions. But it's so fascinating to me. And this world, as it's opened up to me, the word mitochondria, I mean, my wife is so sick of me saying the word mitochondria. She's like, people aren't going to come to our place because, you keep talking about mitochondria. I said, listen, eventually that word is just going to be a household word. Everybody's going to be around. Hey, have you fed your mitochondria? Have you shown a light on your mitochondria? And so we want to make this terminology just household names.
That's fantastic. And hopefully when your wife watches this, she'll probably call me and say, don't encourage them.
Yeah, that's right.
So hearing that, and I got to be careful because the data geek in me would start to go take this and where nobody want to listen. But one question I have with the mitochondria, and I'm really interested in your opinion on, is this. Knowing now, I just turned 52, but when I think back to what I considered old age, my grandparents, aunts, uncles, and what I envisioned as old age, doctor, do you think we've been kind of conditioned to accept that idea of old age being decrepit and basically saying, you know what, we're 75, 80 years old, that's kind of the end of the road? Do you think with the advancements and more education on the mitochondria, the cell energy, everything that it does, are you starting to see that we're getting closer to really extending not just our lifespan, but our health span?
Yeah, I think I mean, that's great. And I love the fact that you talk about, lifespan, versus health span. And I think, they're a little bit, they're obviously different things. It's how long you live and how well you live, right? Those two things. And they're both important. Although, I think the first thing we need to do is focus on health span, how good we feel every day, right? Because you get one at bat at this thing, and if you're just not feeling well, man, some long days ahead of you, right? So doing something about that. And then as far as extending life. So I think on both fronts, the answer is absolutely yes. We know from a health span standpoint, treating your mitochondria kindly, treating all those, bacteria that live in your gut kindly over time, and then just overall staying, just doing, resistance exercises and things like that can just incredibly improve your health span, how well you feel well into old age. And then as far as the lifespan thing is, I think we really are on the cusp of being able to extend life quite a bit. I think some of the advances in artificial intelligence are going to allow, for example, to look at, like, how proteins fold. It's been a mystery. I mean, it took so long to just figure out how different proteins fold. I mean, this is all like really advanced biochemistry. But if as we learn how proteins fold, the amount of molecules, this is more, on just really the medical side, that are going to be able to be given, to people, or to potentially extend their lives is going to grow pretty exponentially. I mean, AI, it can go either way. We can have an entire, discussion of AI. That's a whole, other thing. And I think another thing on the more extending life is, I think, some of the not so what we're doing by our wellness clinics and just kind of our holistic approach is trying to get people, like, man-made diseases and what we do to ourselves improved. There's also the other side of it, where there are some genetic components that we just necessarily can't change. And there's something, called CRISPR, which is genetic engineering. And we're going to be able to just kind of reverse, genetically engineer ourselves to be able to potentially, live longer lives. Now, there's going to be some bumps in the road. There's going to be some other, things there. So I don't want to go too far down that route, because that's not really, an area that I focus much on. But I think there's going to be some fascinating stuff coming up as far as kind of like extending our lifespans to 110, 120. Who knows? And, there's some great people out there, like Peter Attia and some of these other, gurus that, I mean, that is really their main focus. But one of the other things that you just said, which I mean, it's so near and dear to me, is the fact that accepting kind of where we are in life and our ages. And I see that a lot. And so, now having turned 50 myself, and having a lot of, 50 somethings and 60 somethings, even 40 somethings, and they're sitting in front of me. And I can just see it. And I love talking to people about their personal lives. That's just who I am. I'd rather talk to them about that rather than spine surgery, again, because having like like a deep esoteric discussion about like the type of screws we use, that's of no benefit, right, to the patients. And so I see these people sitting across from me, and they're similar to my age, or a little older, a little younger. And I can just see they've kind of given up on themselves, right? They've given up on their diet. They've given up on exercising. They've just plain given up. And you could just see these people, right? Their shoulders are slouched, their heads are down, and they're just done. And they've just accepted the fact. They're like, yeah, I'm getting older. I can't really exercise anymore. My joints hurt. I don't feel well. And they think that that's a normal part of aging. And I'm going to just say, and I just tell them, I said, listen, I'm just going to tell you, it's not a normal part of aging. Tell me what your day's like, and tell me what your day's like and what your week's like. And and if you keep doing that over months and years, I could tell you what you're going to look like in 5 years. But if you reverse course and you do X, Y, and Z, even the simple stuff. Some of these people, you're talking basic. How about, like, instead of 4 ice creams a day, let's go to 1? Is that possible? You know what a big deal? You know what a big deal that is for some people? It's insane. And so just really, and coming from a completely humanistic, man, we're all the same. I know I'm a doctor, but I'm just a person. I struggle with the same things you do. I just try to tell these people, listen, if you just let's start with the most simple, basic changes, right? And if they're willing to accept things like, hey, maybe they'll try intermittent fasting, right? And I just say, hey, and I was like, it's the easiest thing. You just eat from like 2 o'clock to 8 p.m. And that is going to make a dramatic, it's insane what some people like undergo. Then we'll start laying in, hey, let's go to the gym. Hey, there's these great trainers that, I know that I can send you there because you live in this town, and so on and so forth. And so it's amazing how much people don't have an understanding of how their daily habits add up to the person they are sitting in that chair that's sitting in front of me. Just an anecdote. We just love saying that, like, me and my physician assistant, we had this one patient. She's a riot. This lady, very funny lady. But I asked her, so I tried to put her on a diet. And at that time, I was more big on the paleo diet. She did it for like a day and then she went away. But she was very excited. She came in. She's like, "Doctor, after we had our talk, you'll be very proud of me." She's like, "You know the Chips Ahoy bags?" She's like, "I went from eating three rows of it to just one row of it for my dinner snack." And I said, "That's awesome.
Mm-hmm.
That's awesome." So just a little change like that, but I mean, but obviously that's still ridiculously outside of the bounds of what she should be doing. But little baby steps.
Wow. You mentioned Chips Ahoy too. I know when I was going through my weight loss journey, I used to tell, I laugh now, I say I was OCD, obsessive cookie disorder. Man,
They are they're delicious. I have to say they are delicious. I don't think I've had a Chips Ahoy for forever because they're addictive. They're made to be addictive. It's literally in the design. They have engineers that program these things to addict you to that food.
yeah, it's, man, you just, I'll tell you, doctor, you really, really get me excited. And it's great conversation. Another thing I want to ask you was from the orthopedic spinal component. We'll change gears a little bit here, but something
Sure.
else that's kind of been near and dear to me. Um, I had a conversation a while back. I actually now continue to, I look at myself and I consider myself an athlete. And it's kind of me trying to change my mindset, right? Not just I want to exercise. I'm an athlete. I want to achieve athletic performance. So I noticed and I read some of the things about you with your treatment, some of the non-invasive stuff. How are you working to help improve that athletic performance, even with people that may be non-athletes?
Great question. Great question. And so now, going down that rabbit hole, we've already talked about the nutritional component, which obviously improving your nutrition is gonna make a world of difference for your athletics. But really where I've changed my mindset and have brought it to the wellness centers is looking at more hacking, right? How do we hack the body to perform better? And it's going to work for non-athletes and athletes. And so, in our clinic, we actually have anywhere from weekend warriors to people that they haven't stepped in a gym for 20 years but want to be athletic, want to get back to at least jogging, whatever it is, a half a mile a day, things like that. Up to, we have elite, I mean, we have some really elite athletes from the University of Minnesota that come here. We've got just really a basketball star, Daniel Freitag, who you might see some of his stuff out there. I mean, his journey was like he's here every single day, 2 times a day,
Mm-hmm.
obsessed with it. His hero is Kobe Bryant, and he is so this young man is so impressive. It's pretty amazing. But getting back to the hacks and how they improve your athletic performance, and so the modalities that we're offering currently, and we're going to expand them as we learn more and we really kind of meet with all these experts and figure out like what do we really need to bring to enhance performance. But if you look at like the red light therapy, the way that works is again enhancing your mitochondrial function. That's well known. There's 5,000 articles written on red light therapy. People don't know how well written it is. We do exercise while under oxygen therapy, which has been well known in the kind of the long distance community, especially like cyclists and decathlon people, all these people that really need a tremendous amount of ability to process oxygen better. So a lot of people know about hyperbaric chambers.
Mm-hmm.
And a small segment of the population does hyperbaric, quite frequently, especially like in Hollywood, it's big, and a lot of athletes will do the hyperbaric chamber. The idea behind the hyperbaric chamber is you're pushing the oxygen in, right? You're going into these pressurized chambers and you're getting an amount of oxygen and trying to push it further, deeper into areas that don't normally get a lot of oxygenation. Exercise while under oxygen, what we do is you're breathing pure oxygen while you're exercising, and you're only exercising for 20 minutes. You're doing 3 bursts of exercise. And so instead of pushing oxygen in as you are going, from aerobic to anaerobic respiration, okay, as you're getting tired, So your tissues are lacking oxygen, and now you're pulling in pure oxygen, and that's getting out to tissues and your organs in a very different way. So your oxygen levels in those farther areas are increasing. And as far as an anti-aging modality, hyperoxygenation is a fantastic way to slow down the aging process. But from a sports and recovery, if you do that only 10 minutes 3 times a week, then your capacity or VO2 max to take in oxygen and use it increases independent of doing any other exercise other than doing that, which is really, it's amazing. And this is all these are things that I've learned over the last couple of years, as I've dove in, and it's just fascinating. We do another thing called structured water, which is it's charged water. It's just it's a little bit more difficult to explain, but basically it's taking water using technology, and basically you're breathing it in a format that your proteins can use to appropriately fold better. And so we use something called the Nano-V device, which we love because it's inhalable, device. They've got tons of I encourage our listeners to go out and look at this. It's called Eng3, the name of the company. But basically what it does is it helps your proteins to fold better. So in lay terms, all your proteins work better, and it's almost instant. So we did our own trial internally in our clinic because we're very skeptical. I know what the data shows, I know what the research shows, but we're skeptical. So we put one of my partners, we put EEGs on his head to measure his brain function. And he was having a little bit of he was a little crabby. He had a long day and he was done, just one of those days, he had nothing left in the tank. So we had an electrophysiologist come, he put the EEGs on, quantitative EEGs. And so we just look at a tracing. And so in layman's terms, the tracing showed that his brain was fried, right? So the front of his brain was not communicating well with the back of his brain. Within 3 minutes of breathing this structured water and his proteins working better, it looked like a bomb went off in his head. And the connectivity inside of his brain exploded in 3 minutes. And then it slowly continued to increase from there. But in just 3 minutes, it was an incredible increase. So you could imagine if you're having difficulties with, needing to get that that energy back and re-energizing and more on the protein level, then, breathing in this structured water, really, really, is going to help you to improve. And then the last of the modalities for our athletes, and I can get into the recovery from injury after. I'm sure you're going to get to that. But the other modality is pulsed electromagnetic frequency. And so we have these beds. And so one of the things that I'm sure you've heard of is earthing, which is basically just walking barefoot on the ground. Yeah. And so that charge recharges us, right? And so that's kind of how we came up with one of our slogans, which is recharging the human battery. And so the charge of the earth has actually decreased over the last, several 100,000 years. So in many ways, not only are we killing ourselves with diet, but now we're not able to recharge ourselves as much. And we're usually wearing the types of shoes that we don't get that charge, and so on, so on and so forth. We're on the second floor, so we don't get it, whatever. And so these mats are set at different levels. And so you can actually literally recharge your cells and recharge that energy by being in a magnetic field. And so as a spine surgeon, interestingly enough, I've been using magnetic fields for my entire career because there's something, we put these belts on when we do back fusions, and then like a neck, something around their neck, a neck collar with an electromagnetic stimulating device that creates a magnetic field around them, which stimulates production of bone. So it's great for bone healing. And so electromagnetic therapy is great for recovery, but it's also awesome for people that have osteopenia or osteoporosis and a whole host of other chronic diseases. Now, what happens when you take all 4 of those things and you do them all in one setting? Right now, you're magnifying that. So we're trying to quantify that. We've seen great results, and it's great for the athletes, and it's great for non-athletes that are looking to improve their mental and their physical performance.
Man, this is fascinating stuff. I feel like my mind's spinning. We're gonna probably have to. I'll just tell you right now, I'll warn you, we're gonna have to do a second one because as you're talking, I'm already like, wow, this could go on and on.
I would love to talk to you again. This has been great.
Yeah, no, I definitely want to do that. I did have two more things I did want to ask.
Sure.
You mentioned recovery. I want to take a couple steps forward though, because I think one thing we probably don't do well enough, and I think it really helps with our recovery, sleep. And I know that you talk about some sleep quality. Is that something that you're, discussing with patients and ways to improve that sleep quality and how important it is?
Yeah, I think, one of the, like sleep quality is very, important. And, depending on the, the studies you look, the amount of sleep you need is obviously important, but also the quality of sleep you're getting is important. So as a physician, I think one of the things that I'm always most attuned to with my patients, this is very specific to some of the patients we see, especially in that obese population, is the prevalence of sleep apnea, and especially undiagnosed sleep apnea is just it's huge. And I
Mm,
have actually doctors in town that I refer a lot of my patients to have sleep studies because of their weight, and they clearly have sleep apnea and they don't feel refreshed. And one of the big signs of sleep apnea is you sleep for 7 8 hours, you wake up and you're just still feeling awful. You may have
mhm,
sleep apnea, so that's something people should definitely be asking their doctors about. So really handling the sleep apnea situation, and then there's obviously there's some procedures that can be done, and so some other stuff. The Breathe Right nasal strips guy who's here in Minnesota too, but a lot of people will need to look at doing like CPAP machines and things like that to look at the quality of the sleep. I think I talk to my patients, even though personally I don't do it, myself, because I feel like my sleep quality has been pretty good with all the modalities I do. I do a lot of, sometimes I'll do like red light therapy right before I go to bed too, which helps. And there's other hacks
mm,
that I do, but I do think that the wearables can be a significant, thing that you can use to just kind of track what your sleep quality is like. So whether it be an Apple Watch or
mm,
a Fitbit or one of those things, so people can look into that. But there's no question that quality of your sleep is associated with your overall health, development of chronic disease, and then obviously your longevity. Because there's no question that people that have poor sleep quality end up dying sooner and being sicker. Now, some people that are watching this are going to say, "Hey, you're Mr. No sleep because there's too much to do." And so I focus more. I've sort of blessed genetically that I don't necessarily have to sleep. I've never been a I've never slept for 10 hours, even
mhm,
when I was a kid. That's just not who I am.
mhm,
But I don't sleep as much, but I do definitely focus on my routines, at night. Making sure that, decreasing the blue light exposure, like to do, some, even if it's brief, at least 10 minutes of yoga at
mhm.
night before I go to sleep, relaxing the psoas muscles, doing some stretching and other things. And so, I do talk to patients about that, but I think a lot of that on the patient side is more at looking at what their sleep quality is, and medical things. And the last thing I want to say on the medical front, which is it's really, really important. A lot of the medications that our patients are on are a problem with their quality of sleep because they don't get to get into that deep state of sleep that is going to be
Mhm.
most restorative. So that's something we look at, and I always encourage people to really go to sleep experts, and we have really some really good ones here in Minnesota. And then the other thing, as you know, I'm a spine surgeon, and so I see a lot of people that are in a significant amount of pain, and we look at ways to decrease, obviously, their level of pain without using, drugs which in too high a quantities,
Mm.
especially narcotic medications, and especially things like Valium, which is like severely addictive and it's very hard to get off of, and there's just a lot of side effects coming off. But in certain cases, we'll have to go bigger guns because patients have really serious conditions. They can't get in for surgery for a week or 2 weeks or something like that. So um, sleep is very important.
Man, this has been fantastic, Doctor. Last question I did want to ask you, and obviously throughout this conversation, you showed how just much of a go-getter and the way you just excitement that exudes off you. So as you continue with your career and your life in general, like what are you hoping to, contribute medically, professionally with your life to help people and just improve and leave the world a better place?
Yeah, I appreciate, that question. And I just want to like appreciate, your posts. Even I think you posted today, great. I haven't gotten a chance to comment on it. Great. But it's about really having, a vision of kind of who we are as people, how we can be our best selves, and how we can contribute, right? And that's what your podcast is all about, right? Even as we get older, right, we might just be starting. So I'm hoping me and you are just getting started in what we can bring to the world. So I think that's a great question. I think on the spine surgery front, I just want to continue to really help my patients, be that accessible guy, and continue to run our practice, and continue to grow, and really, be that kind of, go to, spine and neurosurgery group here in Minnesota that patients can count on, to get their health better, and go from there. I do have bigger, sort of aspirations and visions about what I hopefully can contribute into the kind of the broader world, and I'm hoping to reach at some point, a very, very big audience. And I think that my niche as a surgeon who has dealt with so many, patients that are sick, and seeing how that eventually really affects their life negatively, taking all that knowledge that, and experience that I've had seeing those patients, and then combining it with really diving in, like I want to just say like a madman, because I think if again, whole self in, whole self, hokey pokey, right? It's not about putting your left foot in. You got to put your whole self in to make this work. So what I'm hoping to do is, again, build my kind of brand, as far as being somebody that just wants to just say, hey, I didn't invent these things, but they can change your life. And I want to bring that, to the world as a surgeon. And maybe people will listen to me in a different way, than they might, for some other people, because they're like, well, he's seen it and now he's become a convert. And maybe we should listen to, how has it changed his life? How has it changed other lives? And so I really want to bring the kind of these ways to make us metabolically healthier, better people, improve our health span, eventually potentially improve our lifespan, right? Although that's not my major focus at this time. I just want people to lead better lives, because again, it's just like, it's heartbreaking to see people not doing well. To me, it almost hurts. And then to continue to expanding that, and having others kind of come on board, other medical professionals, people that are surgeons, and all kind of walks of life, and just saying, you know what, we got to look at people as a whole, because this chronic disease problem in America, in the West in general, is completely out of control. And guess who made this crisis? We made it.
Mm-hmm.
Right? We made it with our food. We made it
Mm-hmm.
somewhat with the medicines that we're prescribing to people. We've developed this. What can we do now to reverse this, but really educate and inform not just the general public, but how can we inform other people that can influence other people? And as you know, it's exponential, right?
Mm-hmm.
If I can get two doctors on board, then, and they get two doctors on board, right? It's like it's that miracle of exponential growth that Warren Buffett always talks about. Next thing you know, everyone's walking around talking about biohacks. Oh, did you do your red light? Did you get your laser therapy for your ankle injury? Did you do this? How are your mitochondria doing, sir? Oh, they're doing great. Thank you for asking. That kind of stuff. I just want to be part of this revolution. And it's just going to take an army to change, the direction we've gone in. And I just want to be part of that. And if I can be, it just would be amazing. And I can't be more excited about it.
Doctor, I don't have a lot to say to that except this. Thank you. I
Wow, thank you. I appreciate it.
we need more like you. And I truly mean that. So I just
Thank you.
awesome stuff. On that note, now you got me. I forgot what I want to say. No, how can people find out more about you? I'll put some stuff in the show notes, but you got anything you want people that they should look at, website, anything like that?
Yeah, yeah. I love it. You can, as far as my myself as a surgeon, they can go to a website. It's sinicropispine.com. They can go to Midwest Spine and Brain as well, to look up our company and what we're doing. And then as far as, our wellness clinics, they can go to hyperchargeclinic.com and see some of the things we're doing to try to, make people's lives better. And I know we both love more people to follow us on LinkedIn, and, as we try to, spread the word about, being our best selves.
Doctor, this has been fantastic. Not only appreciative of obviously your skill as a surgeon, just your authenticity on wanting to help people. I think more than anything is what shines through. And I'll say this, you're almost a magician too, because you made me seem smarter today, which is very hard to do. Ask my family. So fantastic stuff. So listen, everybody, thank you so much. This is definitely a little bit outside of, what I normally do. And I want to do more of it because it's really excited me today. Doctor, thank you so much for being gracious with your time. I appreciate it.
Thank you. It's been an honor talking to you.
All right. Thanks, everyone. Take care. Bye.
This has been the Bare Essentials. Thanks for listening. And remember, never hibernate on your goals.